Hello, today we will talk about foot care for diabetes. The first way to prevent the development of diabetic foot syndrome, that is, the formation of ulcers, is to examine your feet daily, especially the plantar surface and between the toes, so as not to miss cuts, cracks, corns, calluses or other injuries through which the infection can penetrate. It is convenient to inspect the plantar surface of the foot with a mirror placed on the floor, or ask a family member to be examined. For the examination of the legs should be regularly in the visit of patients to the office in the diabetic foot, or the examination of the legs can be carried out during a visit to a consultation with an endocrinologist. Very carefully treat your nails, cut them straight, without rounding the corners, but rather file them with a glass nail file. If the nails thicken, with the help of a nail file, the nail can be given a normal shape, grinding from above, leaving only 1–2 mm of thickness. After use, the nail file must be washed or treated with any antiseptic disinfectant. The glass nail file is the safest for nails, durable and at the same time inexpensive. If the nails are not amenable to processing, with the help of a nail file at home, a medical hardware pedicure will help you. Hardware pedicure performed in a medical institution is perhaps the most effective and safe method of treating the skin of the feet and nails. In patients with diabetes mellitus, it should be performed by a nurse or doctor and be combined with a general examination of the lower extremities. It must be remembered that a hardware pedicure performed unprofessionally can lead to injuries to the skin of the feet and infection in the wound. Therefore, we advise you to contact diabetic foot offices or specialized endocrinology departments. It is important to treat the skin of the feet with urea cream in the morning and evening. Urea is a good way to moisturize and exfoliate rough skin. Note that the cream is not applied between the fingers, as weeping and cracks can form, which can get an infection. After moisturizing, it is necessary to wear socks with a wide soft elastic band or without it. If the skin on the feet is dry, flaky or there are already cracks, this is a warning that there is a risk of ulceration, in other words, diabetic foot, but this can be prevented. In such a situation, hardware pedicure also helps well. One of the questions asked by patients is how often to perform a pedicure. The frequency of this procedure is individual and depends on the condition of the skin of the feet and the quality of care at home. On average, skin treatment with the device is required one time in 2 to 3 months, and then the patient independently maintains skin health at home. Let me remind you that it is best to carry out treatment in the diabetic foot office or a specialized endocrinology department, where a doctor or nurse, together with careful care, will examine the lower limbs and individually talk about how to prevent the formation of ulcers on the feet at home. It is recommended to wash your feet daily with warm water, using soap or helium appropriate for your skin type. It is necessary to actively wash the plantar surface of the foot and between the toes. It is undesirable to keep the feet in water for a long time, especially in hot or in baths, since when steaming, the skin becomes soft and devoid of protection, therefore vulnerable to injury and infection. The most suitable remedy for treating rough skin of the feet at home is pumice. Often renew volcanic pumice stone or use cosmetic, made of synthetic materials, self-grinding, thus not accumulating infection. It is not recommended to use a blade, scissors, metal graters or a corn plaster to remove corns and calluses. After washing, it is important to wipe your feet dry and not wait for them to dry on their own. It is best to dry with a towel specially designated for the feet, doing it with blotting movements, especially not forgetting to wipe between the toes. After washing, lubricate your feet with any preventive cream containing urea, which exfoliates and moisturizes the skin of the feet well. In this case, the cream should be worn only on the sole and back of the foot, avoiding interdigital spaces, where there should always be dry skin. After moisturizing, wear socks with or without a wide, soft elastic band. And it is advisable to wear socks at all times to protect the skin from drying out and getting small foreign objects, such as dust or sand. Studies have shown that these simple rules of foot care reduce the risk of ulcers, gangrene, and amputations on the lower limbs by 3 to 4 times. This is much more than the effect of any drug. Thank you for your attention and be healthy.